Thank you very much, and thank you very much for taking the time to be here for what I hope is a stimulating conference. So food as prevention for diabetes. Like Dr. Jenkins, I actually used to get quite a bit of money from drug companies, but since I got into food as medicine, things kind of dried up, so there you go. I think there's quite a few members of the public here as well. I just wanted to make a statement that might apply to a lot of the talks here, that actually we're talking about prevention, but actually a whole food plant-based diet can actually reverse a lot of chronic medical conditions. So if you have high blood pressure, you get into a plant-based diet, you might not have high blood pressure anymore. But if you're in a bunch of drugs for that, you might have low blood pressure and get lightheaded. And it's the same for diabetes as well. If you're on a bunch of medications for your diabetes, you might have low blood sugars. So let your physician know if you're making significant changes to your diet so that they can make any changes as you become less diseased. And then just a general reminder that it's very hard to find a completely balanced diet, but vitamin B12 and other supplements should be considered. I have an evidence-based website at foodisprevention.com that goes over that in detail. So let's move on to obesity, a growing problem. Here is some data from Canada from 2000 through 2012, where you can see the color coding of the different provinces, the codes along the top. And as you can see, there was a progressive increase in obesity in just the space of 12 years. This is a report from our government in 2016 stating that almost 2/3 of Canadian adults are now overweight or obese, 1/3 of children are, and we rank as number 5 in the world in terms of obesity. Approximately 62% of the Canadian diet is processed and ready-to-eat foods, and this is a significant contributor to the problem. Why is it a problem? Well, here's a graph, for example, that shows on the horizontal axis the percentage of your diet or total energy that comes from ultra-processed foods. That's the horizontal. And the vertical part here is how much of your energy is from added sugars. And basically, the more ultra-processed foods you take in, the more added sugars you have in your diet. And that is really not in your best interest. Here's a very recent study that came out about 10 days ago, where they did something quite interesting. They basically took 20 adults, and they, for 2-week periods, they offered them either unprocessed food or ultra-processed food. They didn't restrict them in terms of calories that they could take, and after 14 days, they switched them. So one group initially would have been given unprocessed food for 14 days, and then they flipped them to processed food, and then the other group was the reverse. And they didn't tell people how much they could eat. And so it was in random order. But the other thing that was really interesting in this study is that the two diets that were offered were matched for calories, matched for sugar, matched for fat and fiber, and matched for macronutrients, which I presume are things like proteins and fat. And so although the diets were matched, they were allowed to eat as much as they want. What happened? Well, point 1 is the top of the graph. You can see that the group that had ultra-processed food was having about 500 calories per day more. And that was just people being allowed to eat what they wanted. The bottom graph is actually what happened to their weight. In the space of just 14 days, the people who had unrestricted access to ultra-processed food gained 900 grams. The group that had unrestricted access to unprocessed food lost 900 grams. So that's basically a 1.8 kilogram difference in weight in 14 days. So perhaps you can see the implications of a processed food diet. When I chat about this with patients or public groups, most people say, well, I don't eat processed food, but I think most of us don't quite realize what that involves. For example, on the left part, that is an unprocessed bunch of snacks. The stuff on the right is considered processed. It's actually considered ultra-processed. Here are some other examples of ultra-processed foods, things like jams, canned soups, etc. Here are even more examples of ultra-processed foods. And so I think we need to be very aware of this since it's probably contributing. So who does have obesity in Canada? So this is a breakdown by age and gender. And what you can see, males being in blue, after the age of 20, obesity is more prevalent in males until about menopause, at which case it's fairly matched at a range of about 20%. Why is obesity a problem? Well, here, for example, is some data on all-cause mortality. This is an incredible study. 198 studies were combined with 3.9 million subjects. To get into the study, they had to be a non-smoker and healthy, and then they followed them for 5 years to see that they were still a non-smoker and healthy, and then they looked at the effect of weight on overall mortality. So body mass index is a common way that weight is assessed because it takes height into effect. Normal is 25 or below. So as you can see, as soon as body mass index reaches 25, in the 25 to 30 range, there's an approximately 11% increased rate of total mortality. When your BMI gets closer to 40, you have an approximately doubled rate of mortality. So as the BMI goes up, all-cause mortality increases. But that's not all. Here's a list or table of diseases that increase 1 to 2-fold, 2 to 3-fold, or more than 3-fold with obesity. And I'll just let you read that for a minute. As you can see, there are multiple diseases, including diabetes, hyperlipidemia, insulin resistance, which drifts into the metabolic syndrome, heart disease, hypertension, cancer, nothing that we would really want. So here is once again a graph that shows body mass index on the horizontal scale and relative risk of death from cardiovascular disease. Who can tell me at what BMI does the risk of cardiovascular disease start going above 1? Yeah, like at 23 and certainly at 25, it's already getting above statistically. These are called error bars. So once you hit the upper limit of normal, your rate of death from cardiovascular disease starts increasing, and it keeps increasing to 10-fold or more. So that's upper limit of normal. What about cancer? What BMI does your risk of dying from cancer start increasing? Same again, it's the upper limit of normal, 25. So really, if you just go on Google, it'll be easy for you to calculate your BMI. I think I did it yesterday, I was 23.6. But as soon as you get above 25, these are risk factors. So here's the rate of self-reported diabetes in Canada from 2001 to 2014. So it's sitting at about 7.5% for men, about 6% for women. Now it's probably even higher. Can we prevent diabetes? Actually, being pre-diabetic is what got me into the whole of the subject of food as medicine. So I started giving talks on diabetes prevention. This is one of the first studies that I presented in a talk that I gave, and it's an amazing study from the USA. A study this thorough will probably never be done again. So they wondered if a lifestyle intervention or treatment with a drug called metformin would be able to prevent or delay the onset of diabetes in people who are at risk. So it was a randomized controlled study. That's how we prove things in medicine. They had 3,200 subjects from 27 centers in the USA who were at increased rate of diabetes because they had an elevated body mass index and they had an elevated measures of blood sugar or a glucose tolerance test. So these were people at increased risk of diabetes. So what they randomized them to is basically a placebo group, quote, do what your doctor tells you, and take a placebo, or do what your doctor tells you and take a drug called metformin, or an intensive lifestyle modification group. The goal here was to lose 7% of weight. That was done with a combination of exercise, 2.5 hours of exercise per week or more, and a, quote, healthy, low-calorie, low-fat diet. I'd like to make very clear this was not a vegetarian diet, this was not a vegan diet. This is the conventional approach. It's like an American Heart Disease Association diet, or perhaps like the old version of the Canada Food Guide, but there would be meat, dairy, etc. in it. So the outcome was the rate at which people developed diabetes. And the other thing that they did is the intervention was very intense. They would have 2 to 3 meetings, one-on-one per month for the first 6 months, and then monthly one-on-one meetings afterwards. This will never be duplicated in clinical practice. We just don't have the resources. So this was an incredible intervention. What did they find? Well, weight went down promptly in the first 6 months. Lifestyle group is here in the bottom, and it stayed lower, averaging about 5.6 kilograms lower out of 4 years. That was significant, so that looks good. Here is the rate of developing diabetes at 4 years. The placebo group, about 37% developed diabetes. The metformin group, about 27%. The lifestyle group, about 20%. So when we look at clinical trials, we have something called the number needed to treat, which is how many people you need to treat with something to prevent the outcome of diabetes. If you treat 14 people with metformin, you can prevent 1 case of diabetes. If you treat 7 people with lifestyle, you can prevent 1 case of diabetes. So lifestyle is more effective. So that sounds really good. They then extended this study out to 15 years, and here is the data in this study that looked at glycosylated hemoglobin. That is a blood test that basically averages your blood sugar for the previous 6 to 8 weeks. So it's like they checked your blood sugar every day and averaged it. So it's now used in the diagnosis of diabetes. Normal is 6% or below. Once you reach 6.5%, frequently they say you have diabetes. So here in the lifestyle group, the good news is you can see that it went down at 6 months and 1 year. But then what happened? It starts creeping up. not only does it start creeping up, look at the slope of that curve versus the placebo curve. It's almost identical. So as someone who had pre-diabetes giving this data, I was starting to feel a little dismayed. I'm going, really, this intervention that'll never be duplicated in the real world, maybe it buys you 2.5 years of lowering your A1C. Then you're basically back where the placebo group is, in the sense that you're going up at the same route as they are. They then extended the study out to 15 years. And the placebo group, 60% of them got diabetes. The lifestyle group, 52% of them got diabetes. Now that was a statistically significant difference, but I have to admit for myself, I find myself saying, wow, at 15 years, there's a 52% chance I'll have diabetes. This is not what I call success, but that is the best that the conventional approach can achieve. What to do? Well, you can try doing some exercise, slightly off topic, and this is my only slide that shows if you do 150 minutes a week or more of weights, you drop your rate of risk of developing diabetes by 34%. If you do 150 minutes a week or more of aerobic exercise, you decrease your rate of diabetes by 52%. So exercise is definitely a good thing to do. Can we have a better dietary intervention? Enter our keynote speaker. So in 1981, Dr. Jenkins invented the glycemic index, and I'm grossly simplifying it when I say that different carbohydrate foods have different effect on your blood sugar, and they can be ranked by how much they raise your blood sugar, and that's called the glycemic index. So when a food has a lower glycemic index, there's a slower supply of glucose into the bloodstream, and it was felt that this might improve the control of blood sugar. Glycemic load factors in the actual amount of carbohydrates in the food as well. And there's an excellent free database at glycemicindex.com. It has over 6,000 foods in that database. So let's start about, can it decrease your risk of diabetes? This is a meta-analysis. So for those who don't understand, each line represents a single study. The vertical line is where there is no effect. Each dot is the result of the study, and the horizontal line is basically called the error bars. At the bottom is the overall statistical summary of all the studies. This is the highest level of evidence that we have in medicine, and this is looking at the association. These are cohort studies looking at glycemic index and glycemic load. Basically, if the diamond at the bottom doesn't overlap the line, you have a significant event, a significant result. So these studies of glycemic index, 20 different studies, showed that people with a high glycemic index had approximately a 19% higher risk of diabetes than those with a low glycemic index, and that was significant. So if you look at glycemic load, you got very similar results. 30 different studies showed that people with a high glycemic load had about a 13% increased rate of diabetes. So it looks like a low glycemic index can decrease your rate of risk of developing diabetes. What about people who already have diabetes? So here is one of the more recent meta-analysis that looked at that. Funnily enough, they only looked at studies after 2008. But here are some studies, for example, by Dr. Jenkins and his group. And overall, they showed that in 5 studies, 574 subjects, these are now randomized control trials, so that we can say that they cause something. A low glycemic index lowers the glycosylated hemoglobin by about 0.2%, which is highly statistically significant. So it works in the treatment of diabetes. If you just look at people's blood sugars as well, there's a statistically significant decrease because the diamond doesn't overlap the vertical line. You drop blood sugar by about 0.4 millimoles per liter. That is highly significant. Here's a different meta-analysis from 2015. This looked at people who had type 1 or type 2 diabetes, and it was looking at glycemic index in treating them. Overall, once again, it showed that glycemic index was effective at treating diabetes. They then did something called a subgroup analysis where they broke studies down of type 1 diabetes and type 2 diabetes, and you can see that the effect is greater in type 2 diabetes, which is the prevalent type of diabetes that we have in Canada. So this is really quite optimistic and encouraging. What else can the glycemic index help us with? Well, here is a combined data. I combined a couple of recent analyses. Yellow basically means statistically significant. So this is looking at endpoints that are relevant to the heart. For example, here, this shows that a glycemic index of greater than 20 difference is associated with a loss of 1.8 kilograms of weight. The yellow means it's significant. And interestingly, mainly the group of people who had normal glucose tolerance had the greatest effect of weight loss of 3.3 kilograms. It seemed to be less effective in people with diabetes. If you look at body fat, there's a significant improvement with a low glycemic index. If you look at fasting glucose, there's an improvement. LDL cholesterol is a significant improvement. Triglycerides is significantly better. Total cholesterol is significantly better. And with glycemic load, both systolic and diastolic blood pressure is significantly better. So there's a lot of evidence that a low glycemic index diet is a good way to go, whether you're trying to prevent or treat diabetes or minimize your risk of cardiac outcomes as well. I always like to put things in context. I always like to compare things. So this is a table that I made that looked at the effects of different drugs. All of these things here are drugs that are used in the treatment of type 2 diabetes. We have 5 drugs and how much they lower HbA1c. And I compared it to the effect of a low glycemic index diet and to structured exercise. So as you can see, while not quite as good as some of the drugs, you're allowed to combine a low glycemic index diet with structured exercise. And if you were to add those two together, you'd realize that you're getting an effect that is similar to many of the oral drugs that are currently used for the treatment of diabetes. So that is very optimistic. Is that everything that diet has to offer? Well, this study came out, and this is the Nurses' Health Study, and Dr. Jenkins actually referenced some of this data as well. A lot of publications have come out of this study. They followed 37,000 men and about 160,000 nurses for approximately 25 to 30 years. To get into the study, they had to be free of heart disease and cancer at the beginning. Every 4 years, they sent them a big questionnaire that asked them 200 questions about what they were eating and about their health. They wanted to look at the effect of meat consumption and the development of diabetes. They adjusted for all of these following variables so that they wanted to make sure that they were looking mainly at the effect of meat consumption and diabetes. A portion of meat, by the way, was 3 ounces of meat. That is smaller than a pack of playing cards. That is 1 hot dog or 2 slices of bacon. What they found is they broke this big population down into quintiles. That means 20%. The top quintile means the top 20% of meat intake, and the bottom quintile, and here you can see how many portions, is the bottom 20% of meat intake. So the people who had the 20% highest amount of meat intake had approximately a 44% higher risk of developing diabetes for men, 30% for women. And if you look at the effect of 1 serving per day increase in meat, you can see that in a combined group, processed meat, 32% increased rate of diabetes, unprocessed meat, 12% increased rate of diabetes. Then they did a meta-analysis, so each one of these is a separate study, and 100 grams of unprocessed meat per day increases your rate of diabetes by about 19%. That's significant. 50 grams, or half the amount of processed meat per day, increases your rate of diabetes by about 50%, or is associated with that. So processed meat is worse. If you increase your processed meat by just 1 serving per day, your intake, unprocessed meat, your total mortality goes up by 12%, and if that's 1 portion of processed meat, your total mortality goes up by 20%. Cardiac mortality goes up by 17 to 22% with just 1 increase of a portion of meat per day, and cancer mortality goes up by 10 to 16%, just 1 portion of meat per day. So even if you can decrease your meat intake by 1 portion a day, you can hope for benefits. Is that the only study that shows this? No. This is a study of 25,000 Seventh-day Adventists followed for 21 years. Self-reported diabetes based on how many days per week they eat meat. If you have eaten meat 6 days per week or more, you have an approximately 2.5-fold increased rate of diabetes. Here's a European study that shows 38,000 people followed for 10 years. Every 5% you increase your calories from animal protein, there's a 30% increased rate of your risk of diabetes. So multiple studies show the same thing. Here is another angle on the Nurses' Health Study, but this time they changed their question. They wanted to look at dietary protein intake and the risk of diabetes. So about 160,000 people followed for about 25 years to look at the development of diabetes, but asking about protein intake this time. Here they broke them down by quintiles of total protein intake. So if you were in the top 20% of total protein intake, you had a 39% increased rate of developing diabetes. They then tried to adjust for body mass index, and interestingly, this effect almost disappeared. So it looks like the effect of total protein is mainly mediated by obesity or increased body weight. That is total protein intake. If you just focus on animal protein, surprise, surprise, the relationship is even stronger. Top 20% of animal protein, 49% increased rate of diabetes. Maybe it's plant protein too. Well, yes, there is a pattern with plant protein. The risk goes down. The top quintile with plant protein has an approximately 9% lower rate of developing diabetes. So it goes in the opposite direction. And here's a breakdown by different sorts of meats. If you substituted 1 portion of vegetable protein for these different animal proteins, how much would you decrease the rate of diabetes? If you decrease processed meat by 1 portion and put in vegetables, that's a 21% decreased rate. Fish is a 13% decreased rate of diabetes if you had vegetables instead. Eggs is an 11% decreased rate. Poultry is a 9% decreased rate. So just 1 portion a day of vegetable protein would protect you. So here's a meta-analysis, a summary of multiple studies looking at replacing animal protein with plant protein. So they looked at studies of at least 3 weeks duration, and they found that in 7 studies with 149 subjects, you could drop HbA1c by substituting animal protein with plant protein, significant. Also significant drop in fasting glucose and a significant drop in fasting insulin. So multiple studies support this effect, and these are all randomized controlled trials, so we can say it's causality. Moving on, what about weight loss? Because elevated weight often ties in with diabetes. So here is a randomized study done by Dr. Bernard of the PCRM that looked at a vegan diet versus a moderate low-fat diet in 62 postmenopausal women who had an elevated body mass index. And they randomized them to either an unrefined plant-based diet or basically a heart-healthy diet, which would include animal products. The interesting thing is that everyone got 14 weeks of counseling on how to do this diet. And then they broke them into 2 groups. One group, they would have 14 weeks of support group meetings every week and then no other intervention at all. They wouldn't see a dietitian, they wouldn't see a doctor, they followed them out to 2 years. The second group had support group meetings from 14 weeks out to a year, and then they had no more support. So this study also looked at the effect of support group meetings. What did they find? Overall weight loss at 2 years was higher with the vegan plant-based diet than the heart-healthy diet. That was significant. Even more interestingly, they looked at the effect of being in a support group or not in a support group. Basically at 2 years, if you were in a support group, you lost almost 4 kilograms of weight. If you were not in the support group from week 14 to week 52, you almost lost no support. You almost lost no weight. So for any clinicians in the group who are interested in starting this, it's really important that you, have patient support groups if you want to be able to change lifestyle. Here's a meta-analysis looking at vegetarian diets and weight loss. Overall, the diamond here doesn't overlap. Overall, it's significant, and there's a 3.4 kilogram weight loss that shows that it's effective. What about people who already have diabetes? Here's Dr. Bernard's study, where he took 99 people with type 2 diabetes who were on medications and had moderate diabetic control. He randomized them actually out for 74 weeks to either take a plant-based diet, which was also low-fat, or the American Diabetes Association diet, which is the gold standard. Funnily enough, in the American Diabetes Association group, if they were overweight, they also cut back their calories. So if anything, I think this study was actually a little trying to help the people in the American Diabetes Association diet. They asked them not to change their exercise, and they followed them for 74 weeks. Here's what's happened to their glycosylated hemoglobin. It went down more in the plant-based group than in the American Diabetes Association diet group. Here's what happened to changes in their glycosylated hemoglobin. It was a little complicated because if you change a person's blood sugar, you have to change their medications. But if you looked at change in A1C before you had to change the medications, there was a significantly higher drop in A1C of about 0.4% in the plant-based group. If you looked at change in weight, there was a trend towards greater weight loss in the vegan group, not quite significant, and also a trend to greater drop in BMI. If you look at changes in lipids, there was a greater drop in total cholesterol and a greater drop in LDL, both of which were significant with a plant-based diet. So while both a low-fat diet and the American Diabetes Association did result in some weight loss, when you control for medication diets, the plant-based diet is better in a 74-week randomized controlled study. Here's a meta-analysis that also looked at vegetarian diets. Overall, they were effective with a 0.4% decreased rate. Here, interestingly, you can see 4 vegan diets compared to a vegetarian diet that allowed milk and eggs, and basically there was a bigger effect with the vegan diets than the diet that allowed the milk and eggs. So it looks like if you want the full effect, you have to go the full way to totally plant-based. Putting this in comparison to multiple drugs, here now we have a low glycemic index diet, structured exercise, and a plant-based diet, and you can see how those might add up. What about the real world, you might ask? Well, there was a very interesting study done in New Zealand that was reported quite recently that tried to assess the effectiveness of a whole food plant-based diet in the practice of a single family doctor in a fairly small town in New Zealand. They took 65 individuals aged 35 to 70, and to get into the study they had to be obese or overweight and have one of these risk factors: diabetes, ischemic heart disease, high blood pressure, or cholesterol. And they randomized them to either the standard care or a whole food plant-based diet, and they didn't even tell them to watch their calories. And what did they find? Well, out at 6 months, if you look at weight loss, you can see that the weight loss was, the weight was about 94 kilograms in the control group and was down at about 83 kilograms in the intervention group. So the difference in change in weight was 10 kilograms, so that's over 20 pounds in a small practice in rural New Zealand. If you look at cholesterol results going out to 6 months, the drop in cholesterol also reached statistical significance in the intervention group, but not the control group. And if you look at the results in HbA1c, there was also a bigger difference in HbA1c in the intervention group than the control group. So this is a relatively real-world situation and looks like it can work. So this is called the BROAD study, and showed that in a 6-month study of 65 individuals, there were significant decreases in weight, BMI, HbA1c, although blood pressure didn't change. So, trying to bring some conclusions, obesity and diabetes are a global problem. They are a problem in Canada. And randomized studies show that lifestyle and a conventional diet can buy you a few years in terms of slowing the progression to non-insulin dependent diabetes, but that looks like it's the best it can do. Glycemic index is an effective intervention. It looks like it can improve outcome. Red meat consumption increases the rate of diabetes by 30 to 40%, and effective dietary interventions include the glycemic index. Didn't have time to show you all the data on the Mediterranean diet, which is basically the plant-based component, is what works there, but the most effective dietary intake to date looks like it's a whole food, low-fat, plant-based diet. So like I said, I got into this as a pre-diabetic. Here's my diet before I got into this and what my diet is now. I also try and ride my bicycle to work in Hamilton. So a lot more, that's an awful lot of information, and people might be left with a lot of questions. What do I have for breakfast? What do I have for lunch? What do I have for dinner? There's a summary of this talk and a copy of the slides on foodisprevention.com. I have some small handouts out at the front desk if anyone wants those too. 4leafsurvey.com is a really cool website. If you go there, it asks you 10 questions and it gives you a score for how healthy your diet is. The score is actually how plant-based your diet is. It might be fun to do that now and then later on. There's an incredible DVD called Forks Over Knives that's in the public library, on Netflix, on iTunes. You can stream it right off the internet. Is a lovely introduction to this topic for you. Feel free to take a picture of the slide if you want. And then there's an incredible book called How Not to Die by Dr. Greger, which covers the role of food in the top 15 causes of death in the USA, and then goes over the different foods. This is actually the beginning, and Dr. Greger's done some amazing work on this. I'll just end by kind of showing this is what he suggests we should be eating each day as part of a whole food plant-based diet. Each circle is actually a portion. So he suggests 3 portions of beans, 1 portion of berries, 3 portions of other fruits, and there's actually a free app which lists this. This probably looks like it's a little complicated to do, but to be honest, once you get into the swing of it, it almost becomes automatic. You kind of end up almost being on an autopilot. But I'll leave things there. Thank you.